Good evening and welcome. You're joining us live tonight from our studios at FBC Suva. And tonight we're joined by Dr. Chemesa Tundravu, the Senior Health Advisor at the Ministry of Health and Medical Services. So thank you for joining us this evening. So we all heard the press conference this afternoon, and in this show we'd like to discuss the $40 million allocation that was recently announced in the COVID-19 supplementary budget. But we all heard the press conference this afternoon, and Fijians were quite relieved, I guess, because for a while there it seemed like one press conference equals one confirmed case. But that was a big relief for all of us. So for someone who missed out on it, what's the current status?
Thank you, and Mbula Vinaka to youth. Our last confirmed case was on the 23rd of March. And that was our 5th case. So we still have 5 confirmed cases in Fiji. We continue to do testing of potential or suspected cases. And so far we've completed 330 tests, and we've confirmed 5 cases to date. So our testing follows our case definitions. We have a case definition that's very similar to what's used abroad. And so the case definition, because it's a respiratory disease, talks about the symptoms of the respiratory disease, but also any history of travel or contact with a positive case. And so we use that as the basis for testing.
So 6 days now, no new cases that have been confirmed. Of course, the ministry has reiterated quite a number of times in the past couple of days that this does not mean that restrictions will have to be reduced. As we know that from tomorrow there's going to be a nationwide curfew that is going to come into effect. Talk to us about this. What does that mean for the ordinary Fijian that has not come into contact with someone who has been exposed to COVID-19 or someone who has been traveling overseas?
Yes. So no new cases doesn't mean that we should relax. We've just confirmed 5 new cases, and if anything, we are merely in the beginning of the outbreak. So at the moment, we are following up on people who are under quarantine, and so they are people who are potential cases for Fiji. So, and we've got more than 100 people under quarantine at the moment. So there's no reason for us to relax at the moment. In fact, we should continue to strengthen the strategies we have in place. Importantly, social distancing or physical distancing. We need to be doing that. Everybody needs to be doing that, as well as being, our personal hygiene practice, ensuring we have practicing correct cough and sneeze etiquette, and hand washing, strengthening on hand washing with soap and water, or alcohol hand hygiene gel if we have.
So with that in mind, Dr. Tundravu, let's look at what's happened from when the first case had been confirmed until now. It's been just over a week for the first COVID-19 positive patient, that is. And also we saw that flights into and out of the country had been stopped as of last week, Saturday. So with all of those people who had traveled into the country on those last few flights, what is the ministry doing in terms of monitoring them? So
as you would be aware, the Prime Minister had given the instructions in his press conference that all travelers coming into Fiji will now be required to go under 14 days of quarantine. So the Ministry of Health is working as part of a whole of government response. So it's not the Ministry of Health alone, but all other government agencies that deal with border control and deal with travelers who come in are working together. So at the moment we are working with the military in ensuring that all who are in our quarantine list are visited, and when they come into Fiji, they get Fiji introduced a supplementary health card, and there is a tear-off at the end of the supplementary card, which gives explanation to the traveller on what to look out for, what signs to look out for of the disease, and what to do if they have the disease. So our team who are following up on the quarantine, and that's health and the military, trained military personnel, they are going out and making sure that all people under quarantine are checked, that they are following.
All around the subject of quarantine, the Prime Minister sometime earlier this week made it very clear what quarantine actually means. But for someone who is who still may not be aware and confused between the terms self-isolation and quarantine, could you please offer some explanation?
Thank you. So isolation refers to the sick person. So the sick person that's taken into a designated isolation facility is that's where we use the term isolation. Quarantine is for the healthy person, and it protects the healthy person and protects the public because the healthy person, given the history of travel, given the history of contact, can be a potential case of COVID-19. So wherever we have a quarantine facility, that's a healthy person that we are putting aside and making sure that doesn't come into contact with other people. In the isolation, it's the sick person, and we are trying to protect the sick person with the treatment that we are giving. So that's the two main difference between isolation and quarantine.
Stay with us. We'll come back from a break and we'll have more for you. So the Ministry of Health received a $40 million allocation in the supplementary budget announced earlier this week. That's $10 million per month, as reiterated by the Health Minister. And we also heard the Health Minister's budget address in Parliament, where he outlined a list of items that the allocation will be used for. So if you could expound on some of the items that were listed there, what are the main priorities for the Ministry, and can we get some insight into the spending of the funds?
Thank you. Firstly, the Ministry is thankful to the government for the allocation of $40 million to help the Ministry in combating this outbreak. The Ministry is targeting a few important areas in its plan of attack. The first is around the messaging and our communication strategy. And that's an important area for us, and the intention is to, inform, to educate the public, motivate them to do the right thing, and to act appropriately in helping us to combat the disease. So we have our communication strategy that covers all forms of media, whether it's written, visual, audio, the social media. We are also working with the NDMO and the divisional commissioners. The Ministry of Health, with the assistance of the relevant government agencies, put together a training communication package, and we've rolled it out to all the divisions, driven by the divisional commissioners, so engaging with the Tikina councils, the advisory councils, in just getting the message across. And we are very happy. In the last briefing we had is 95 to 100% coverage of the villages, the settlements, the people out in the rural community. Who may not have access to the newspaper or the TV. So it's a face-to-face communication package. So we're hopeful that that makes an impact.
Because in the last few weeks we've seen how important communication is, especially with one rumor can spread so far, especially with social media and stuff like that. So spending money on communications is of course a major priority for the Ministry of Health. But talk to us about some of the other equipment and the assistance that's being given to the people on the front line.
So that was one big focus. So one of our other focus is looking at health system strengthening, just system strengthening. So we looked at the screening program right from the border, where our health team, with the relevant agencies, are doing screening of people who come in. All our diseases that we've diagnosed have been brought from overseas. So the border restriction and the border screening is one big component. We're also looking at community screening. As you may be aware, we've set up fever tents or fever clinics. So around the country, there's more than 30 fever clinics that's already set up, and that's likely to increase in number. And the intention is to screen in the public, out in the community, the presence of the disease. People out there with fever, that they just need to come and we have a look at them, and we decide whether they have the disease or not. We also, in addition to our preparedness, is getting our health facilities ready. So setting up our isolation facilities within our health facilities, and also strengthening our ICU capability. As you would know that from what we've learned so far of the disease, that 5% of the people who get sick, they need ICU care. So that's the highest level of health care that needs to be provided. So part of the budget goes towards buying ventilators, buying the monitoring machines, getting the medical supplies, the medicines that we will need for ICU, if and when we reach the stage where we'll be putting people in the ICU.
You mentioned that there are more than 30 fever clinics, as far as you know. It's more than that's 31. That is. What's the response been like in the past 2 weeks? How many people have come forward? Are there anyone that you had to probably monitor even further after they came up to the fever clinics?
So so far we've been very happy with how the fever clinics have been operating. We've been looking at the numbers of people that are attending the fever clinic. Some places the numbers are really high, and some places it's low, and we're just monitoring and asking the questions why it's very high, why it's very low, and making sure that we are covering or have an answers to how the fever clinics are performing. But the fever clinic is an important tool for us because firstly, the patient doesn't have to go to the main health facility. If they have a fever, they just come to the clinic. A health personnel will be there, looks at them, assesses them, decides whether they have the COVID-19 or not, and advises them on what they need to do.
So the reason for the fever clinics, as outlined by yourself and the Minister even earlier, is to relieve pressure off of the main larger hospitals, right? Is there a difference in the level of treatment and care that you receive at a fever clinic? So for example, if I presented myself at a fever clinic, what happens then?
So in the fever clinic, they have, we've put together an algorithm of how patients who come to the fever clinic will be treated. If they are not suspected cases, then we send them to the appropriate place for them to be checked if there are other sickness going on. If we suspect that they have COVID-19, then we have the plan of action for our health staff to follow. For example, if it's a child If it's a child less than 15 years, then there is a plan of action that the person who's operating the health, the fever clinic, would need to follow. Call the pediatrician, get the advice, give the medicine, give the protection, and do the necessary management.
We'll have more for you when we come back from our next break. Stay with us. So, Doctor, in countries around the world, we know that a full-blown crisis has only occurred when health systems, hospitals, doctors and nurses were absolutely inundated with a larger number of cases than they could handle at a time. If we talk about Fiji, how equipped or how well equipped are our hospitals currently and our health systems currently, should there be a sudden spike in the cases of COVID-19?
Thank you. So at the moment, our health facilities and our hospitals equipped and are able to handle any surge in cases for now, for those requiring isolation, for those requiring admission, and even ICU. The new supplementary budget, again, will assist in getting the additional equipment and medical supplies that we need to boost our capacity. In looking at the experience abroad, one lesson we've learned is that even in developed countries with lots of money and adequate medical supplies and excellent health systems, when there is an explosion of cases, they all struggle. They all struggle to handle the load. They all struggle to to attend to the sick people and even to provide ICU care. So, basically what we are seeing that there's no health system anywhere in the world that can handle an explosion of cases. So, basically for Fiji, our target is we don't get to that stage where there is an explosion of cases. So that's our target. That's what we talk about every day. Fiji must never get to a stage where we have an explosion of cases that we can't handle. We talk about flattening the curve. Fiji, what we are doing is targeting to flatten the curve. By flattening the curve, it means that our cases would be to a level that we don't overwhelm the health system. We must not get to a point where the health workers decide who gets what level of care when. When we get to that point,
right,
then we are really in trouble.
A lot of people fail to make the connection between flattening the curve and things like social distancing and hand washing. So if you could make that link for us, for someone who isn't aware.
Yeah. So it's been shown that social distancing is the one thing that is able to flatten the curve. It's the most important thing that we in Fiji should learn now and practice. We are happy with reports of people who are practicing social distancing. We are also worried about stories of examples of people who still don't know what social distancing means. So we are telling people, maintain the space, maintain the 2-meter space between you and the next person. No movement, no mass gathering. We should cut down on the parties, the funeral gatherings, limiting mass gathering to less than 20. We are saying don't share the mbilo when you're drinking grog. The group must have one each mbilo and not share. Don't share a cigarette, kavuru. Better still, just don't smoke.
Right.
But if somebody is smoking, we don't, share the kavuru around it. Don't spit carelessly. And then, in addition to that, we are talking about hand hygiene. So wash our hands at all times, at all opportunities.
So the idea is to slow the rate of infection so
Yes.
that our health system doesn't.
All those measures will help to flatten the curve. Our people need to learn. They need to learn that and put it into their heart. It must come from the head into the heart
Right.
so that they can practice it.
So with a focus on more proactive rather than reactive measures, of course, we've had all of that already implemented. From tomorrow, we'll have the nationwide curfew that will also come into effect. Let's look at something that the Ministry of Health is doing on a daily basis. There was a picture that was shared by the Ministry of Health on their Facebook page about a particular doctor who is at the molecular lab, and that 300 tests had been done, of which only 5 had come back positive. Now, for those who are unaware of exactly what goes on when a test is done, talk to us about how a testing kit works.
So the testing component is a very important component of this, the fight against COVID-19. Because we need testing to confirm whether a person has the disease or not, and the testing, the result informs our next course of action. So the ministry was looking at a reliable testing methodology that gives, the result gives us confidence. So with the assistance of WHO, the ministry has, acquired the machine, and we have started testing using the machine. And because we are comfortable and we are, the machine has been quality assured in terms of testing, we are happy with the results that we are getting. Because I have said before, the results inform the actions that we take. So it's not only the testing, but the testing is one component, but the actions that we take is to treat the patient, to isolate the patient, and all the necessary management that we initiate is all linked to the
There's
testing.
some talk of private individuals wishing to import testing kits for commercial purposes, resell them. Are these testing kits reliable, and does every testing kit have to be approved by the Ministry of Health or perhaps the World Health Organization?
So at the moment, the Ministry of Health is relying on all the tests that are endorsed by the WHO, because that tells us that the test has gone through, all the verification and the quality assurance program that it needs to go through to ensure that the results are reliable. So at the moment, the WHO is, for us, recommending that we use the testing machine that's currently based at our Fiji CDC in Mataika House in Tamavua, and we are in constant communication correspondence with the WHO, and when WHO recommends any other testing methodology or modality, we'll take it up and we'll work with it.
We'll have more for you in our next segment when we come back from our next break.
Dr. Tundravu, before we move on to talking about social distancing, let's follow up on what was left over from testing kits in the previous segment. You already talked about how the testing kit works and how you happen to have a machine. Just to further clarify on that particular note, for those who are still under the impression that it is a kit that is reusable or something that is single use and then is discarded, that's not how it works.
No, it's not. What we have is a machine that we send our specimen to. So there's one machine. It's based at our Fiji CDC that we send all specimen to. It takes some 6 to 8 hours for the test to be completed. So the good thing is we now have the machine in Fiji, As you may have known before, before that we were sending our specimen to Melbourne, so the turnaround time was 3 to 4 days. But now our turnaround time is just within hours, so we are able to get our results straight away.
Also, let's look at what happens to those who are currently under quarantine, under isolation. They're being monitored. The COVID-19 positive patients. We've seen reports come out globally, especially in China, where those patients who had been treated successfully and had been cleared of COVID-19 that had then returned and they had they tested positive all over again. What's the ministry's plan for the current 5 patients after recovery? What next?
So our clinicians at the hospital have put together a treatment pathway on how they initiate treatment, and what are the tests that they do, intervals, until the patient recovers. And it also talks about when the patient is likely to be discharged. However, this disease is a very new disease, and there's a lot of questions that we don't have answers for. So what Fiji is doing is looking at the experience of other countries, and we are learning from what they've done, what they've gone through, the good and the bad, the great result and the unsatisfactory result, and we are basing our actions, on those. So that's the experience that we are utilizing. We are working closely with international organizations such as WHO, who has provided us with the information and with their experience that's helped us to put together our treatment algorithm and how we're going to handle patients.
So in the last segment we left off with discussing social distancing. I'd like to put a bit more emphasis on that, because I personally feel, from what I've seen, that not a lot of people are taking it seriously enough. So from the way the Lautoka lockdown unfolded and the general behavior of Fijians at the moment, all around Fiji, do you think that enough people are taking social distancing with the seriousness that it should be taken with?
We are generally happy with how the members of the public have adopted social distancing or physical distancing. We think that most people are doing what we are recommending for them to do, but there's still some people who need to learn and practice. And what we've seen from the history of this outbreak in other countries, that you only need a small group of people not to be practicing social distancing for the cases to explode and for us to lose control. So we cannot do a half-hearted social distancing. It cannot be just one part of the population as opposed to others. This has to be everybody. Everybody has to buy in, take it into heart and practice it. And they practice it in all the activities of daily living, basically. In all the things that they do, they should be practicing it. Whether they're standing in the queue at the bank, or they're waiting to pay their groceries at the supermarket, whether they are with friends drinking yangona. In all walks of life, we must be practicing social distancing. I've said before, when we looked at some of the models in the other countries that have gone through this, social distancing is the thing that is the action that flattened the curve. Without social distancing, we've seen the curve spiked and overwhelming the health system that's supposed to support them.
Dr. Thunravu, on that note, we saw that social distancing was not being practiced even in more developed countries like our neighbours Australia, which saw a spike in the number of cases of COVID-19 just because people were not practicing social distancing, which led to Australian PM Scott Morrison coming down with a heavy hand for those involved. Now, of course, we haven't had more than 5 cases so far, and as of tomorrow, the nationwide curfew will come into effect. Now, this is in an effort to contain movement. What about its effort about battling infection itself, the COVID-19 spread?
Yes. So curfew is a means of enforcing social distancing. Yeah? So when we stop people from moving, then people don't get to mix with other people and socialize, because as we get more people in together in one place, the opportunity for spread of and transmission of the disease increases. So the ministry is fully supporting government's initiative to put in place curfew. We think it's a very important tool that will limit, our socializing, and it's not going to go on forever. And but this is the sacrifice that we need to put in now. All of us have to be committed to it, so that the flattening of the curve will be everyone's effort, not just Ministry of Health. It has to be everyone's effort.
Thank you. We'll take a short break and we'll come back with our final segment right after this. So starting off our final segment, Doctor, recently there's been some concern that people living in the outer islands or the maritime region will have difficulty accessing services in the event of harsher restrictions being placed. So we're asking you this question from, I guess, a Ministry of Health perspective. Is there a plan for people wishing to come to one of the larger islands to access important health services? Suppose if you're, for example, in the Lautoka lockdown area, and you had an important medical procedure scheduled at one of the larger hospitals, let's say CWM, what happens then?
Okay, so the Ministry of Health has plans in place to address the medical services needs of the population who are in the maritime, as well as those under the lockdown area. Lautoka Hospital is it's a big hospital. It's the second largest tertiary hospital in the country. So it can attend to almost all medical conditions that come to the hospital. So the people in Lautoka area should not worry, because Lautoka Hospital is able to provide the services that are required. I'm not sure whether you know that when the lockdown area was indicated and that restriction was started, the ministry then set up special units at Singatoka Hospital and Rakerake Hospital to take care of the cases who would otherwise have been referred to Lautoka Hospital from these areas. Lautoka Hospital was the referral center for the Western Division.
Right.
So all the smaller facilities in the Western Division, they refer to Lautoka Hospital. But because of the lockdown, we had specialists from CWM Hospital who came into the two facilities. They are still there now, and they are taking care of all the referrals that come from the other parts of the Western Division, outside the greater Lautoka area. For the maritime, we also have plans in place if we happen to, need to evacuate anybody from the maritime, given now that we won't be having people, traveling to the maritime areas. We have our plans in place, and we're able to evacuate, patients from any maritime area in Fiji if the need arises.
It would be irresponsible of us to not address, of course, social media with this point in time. Of course, a lot of people will be turning to social media to take in information. With all of the press conferences, with all of the media's outlets out there putting out fact, there's also fiction that is being circulated. Case in point, just earlier on today, I was sent a screenshot about a particular post that is making the rounds not in Fiji, but in New Zealand about Fijians. Now, to say this, the rumors say that about $720 will be given to Fijians to stay at home. Now, this could be quite damaging given that this is false information. What does the ministry plan to do in terms of trying to contain false information from being spread?
So fake news and false information had been part of this outbreak from the start. And it's been a really challenging issue to address. So the Ministry of Health has put together a communication strategy with our communication team, and one of the strategies to address all the fake news in the social media by putting in the real news, the correct news, the factual news. And we are also encouraging members of the public to go to credible sources of information if they want to learn more about COVID-19. We are directing them to the Ministry of Health website, to all the publications that have come out, media releases, public advisory that came out in the in the news media, but also available in our website. And we've also had our team looking at social media clips that can go out and counter all these fake news.
Very quickly, though, can we just look at the water disruptions? Of course, the budget allocations did say that there would be provisions made to cater for water disruption areas, for water carting, and yet we've still seen numerous accounts of people complaining about, even in major areas, urban areas, of still facing water disruptions. The minister had highlighted on Friday that he would be talking to WEF and having their support in working on this. So many days with no new cases, yet the ministry is urging everyone to practice good hygiene and wash their hands. How do they move forward when there's no water that comes in?
Yes, that's a good point, and the ministry work is, as the Honourable Minister said, the ministry is working very closely with the Water Authority of Fiji and the relevant government agency to make sure that the water supply continues to be made available to the public, and also to the health facilities that look after the sick. So the ministry is working in collaboration with the ministry, with the Water Authority, and we are hoping that all those issues about water supply will be addressed.
So very final question to you, Doctor. After all that's been said and done, we haven't had a new case confirmed in days. And a lot of people are beginning to ask, when will things start getting back to normal? And so health experts and the Prime Minister, the Health Minister have also reiterated that there can't be a timeline on things. We can't put a timeline on things. But in your opinion, in terms of activity, what needs to happen for us to get back to normal? Suppose it's been a month since the last confirmed case. What then?
It is hard to say, and we are learning from the experience of others. As I've stated before, this is a new disease. We don't know all the answers. As the outbreak, the pandemic evolves and continues, that we are learning bits and bits, a bit more at a time, of the behavior of the disease, the behavior of the person who contracts the disease, and how long the disease stays. But it doesn't take the fact away that the one thing that we want to do in Fiji is to flatten the curve. That's, at this stage of the disease, we can interrupt and stop the transmission and flatten the curve if we practice social distancing.
So in terms of this afternoon's press conference, in spite of no new cases being confirmed, it's not life as usual for Fijians. The ministry's message is to still carry on with those measures.
Yes, it's definitely not over. In fact, we've just begun, and we should never let off. we should continue. Learning from the experience of China. China was, started off with that huge spike and then coming down. Just when they were settling, then they started to import new cases. This time not from within China, but they were patients who came outside China, and they came back and started, the presence of the disease again. So Fiji's response will not be only limited to what we are doing. We'll also be looking at our neighbors, what they are doing.
Now, Doctor, we've come to the end of the show, and before we wrap up, just very quickly, if you could briefly just give us your opinion on whether or not you foresee borders in Fiji that are already shut down being opened up again, with taking in mind what you've just said.
Yes. So Fiji's response will not only be dependent on the way the outbreak happens in Fiji, but will also depend on what's happening in other countries around us. What happens in those countries will dictate when and by how much we open our borders to them. We still need supplies, we still need tourism, we need medicines and medical equipment from abroad. So all those are taken into context when we were talking about closing borders, opening borders. But I'd like to finish by stating that we are at a stage where we can interrupt and stop this disease. We are at that stage right now, and we shouldn't lose this opportunity. We must practice social distancing. We must be careful with our cough and sneeze etiquette, and wash our hands all the time. Very simple. Wash our hands all the time. And for those who we've decided needs to go into quarantine, please be faithful with your quarantine. Don't break it, don't go partying, but be faithful with quarantine. All those little actions together, all our collective actions will flatten the curve and make the outcome the best for us in Fiji.
Well, Dr. Tunravu, it's been great having you here. Thank you for taking your time out tonight.
Thank you so much.
And that's all we have for you on the show tonight. Thanks for joining us. Stay safe and have a blessed evening.